Well, good evening, everyone. This is Dr. Joseph Kanu. We are broadcasting from Rochester Chiropractic and our show, Simple Truths for Healthy Living, where we talk about simple truths for healthy living.
Hence the title.
And tonight we have Dr. Jeff Haddad. Hi, Jeff.
Joe, how are you?
Glad you're here. I'm always fabulous when you're here.
You just tell that to all your guests. I know
Isn't this great? And we've got our own personal sound man, Joe Huck, from the station.
We appreciate that.
Joe.
Making sure we sound, perfect. Everything we're enunciating and just really our voices are carrying.
He's watching over us tonight. Very good. Thank you for being here, Joe.
Perfect.
So we're going to start. Joe, you want to join us for prayer? Well, we start our show with a prayer.
Certainly.
Here. Okay. And this is 2 Corinthians chapter 5, our future destiny. Okay? For we know that if our earthly dwelling as a tent should be destroyed, we have building from God, a dwelling not made with hands, eternal in heaven. For in this tent we groan, longing to be further clothed with our heavenly habitation. If indeed, when we have taken it off, we shall not be found naked, for while we are in this tent we groan and are weighed down, because we do not wish to be unclothed, but to be further clothed, so that what is mortal may be swallowed up by life. Now the one who has prepared us for this very thing is God, who has given us the Holy Spirit as the first installment, so we are always to be courageous. Although we know that while we are at home in the body, we are away from the Lord, for we walk by faith, not by sight. Yet we are courageous, and we would rather leave the body and go home to the Lord, and so on to be with Christ and have our eternal glorified body. But until then, we have some aches and pains, and we can have cavities and problems, Joe. But the Lord's people suffer for lack of knowledge. Dr. Jeff is going to give us some good knowledge today, so we don't have to groan as much.
We're going to avoid those groans, and I'll tell you, last week we really covered some really, I think, timely topics.
Timely with school starting.
Everything.
Covering ADD.
Yeah.
And what would your dentist do to help ADD?
Right. And when that study came out about how snoring in children is being attached to a misdiagnosis of HD. I mean, that's something that
misdiagnosis. We see that so much.
Well, right. I mean, it's like anything. The migraines of the world, the fibromyalgias of the world. Mm-hmm. Sometimes they become dumping grounds for hey, I'm not sure.
Categorizing.
Yeah, it's like all right,
you've got to name.
You've got a few. Right? You've got to name it. Well, let's not overname it. And I mean, if a child say is exhibiting some of these attention deficit disorders or characteristics, let's just not throw them on medication. Let's take a step back and, see if there's another root cause. And what they found was poor sleep. Obviously, and common sense says you're not getting good sleep, you're going to be, lethargic during the day, pretty difficult to pay attention to things, short-term memory loss. There's a lot of things that go in tension with that.
Daydreaming.
Yeah, right. I mean, you need that quality, refreshing REM sleep. And whether you're a child or an adult, if you're not getting it, your daily life is going to suffer. And so that was very telling to me. I mean, I've seen that in the past. I've found children unknown to the parents that had very poor airways, and that I could see, if I can't see down that hole back there, very difficult for them to breathe, and if they're difficult breathing, that can translate to a lot of other health concerns, which I would like to today kind of, continue with just the overall sleep breathing disorders, because as we talked about last week, I was on my way to a course last weekend, okay? And we went to the beautiful city of San Diego. Which is one of my favorites, but unfortunately I didn't get to enjoy it as much as I wanted to because I was in class all day. But I'll tell you, what an eye-opening course that we took. And it was a sleep apnea and TMD, temporomandibular joint disorder residency. So there's a three
Wow.
weekend
Can you repeat
course.
that? It was sleep apnea, TMD, which
Yep.
we call TMJ.
Correct, TMJ
Right.
disorders, and we've talked about this in the past, but wow, what a way to bring it all together. The fact that TMJ disorders and sleep apnea patients, they're the same types of patients, okay?
Didn't you say like 60%?
75%.
75?
75% of TMJ patients, people who have facial pain, headaches, jaw pain, have some sort of sleep breathing disorder. And 52% of these sleep breathing disorder patients, people who have sleep apnea, chronic snorers, have TMJ symptoms. And it all comes down to a poor bite, a poor jaw position. And I'm going to tell you, it was a wake-up call for me because I know this. I've known this for a very long time. I pay attention to this stuff. And even myself was shown that I don't pay attention as much as I need to with the latest research, and to a point where how much have we talked in the past about grinding and clenching and how
Yes.
I'm a big advocate of protecting the teeth, right? I mean, whether it's a mouth guard at night or if you're having daily jaw pain, we'll make an orthotic that we've talked about, right?
Right.
Did you know, I didn't know this, but did you know that 4 out of 10 bite guards that are prescribed for patients by their dentists actually can make them worse from a sleep breathing disorder?
From a breathing disorder perspective.
Correct. You're trying to protect their teeth,
Wow.
which is noble. We want to do that. But literally, you're putting this piece of plastic in, and it could actually be pushing your jaw further back and causing a sleep breathing problem, which that's scary.
That is.
Do no harm, right? I mean,
Right.
we're trying to do the right
First
thing.
goal is to do no harm.
Exactly. And
So, which really means don't just rely on a store-bought, off-the-shelf at the drugstore mouth guard.
That scares me to death.
Because you're
even
telling
think
me
about
4
that.
out of 10, even dental prescribed.
That's correct.
Wow.
Yeah, you think
now,
about
why
that.
is that? Are they just not educated enough?
No, to be honest, they're educated. They're educated to a point, just like I was educated to a point. But unfortunately, if you do not continue that education, right? And again, not only, I mean, listen, if you're not learning every day, I mean, there's a problem. There's not one person out there that can say, I know everything. I mean,
right.
And if
or
you do,
you have arrived.
That's correct. You're never going to arrive. I mean,
Yeah.
I feel like I'm a relatively intelligent individual, and every day I learn something new. And so you have to keep an open mind. But the biggest thing is that with technology, with knowledge, with education, we're all learning. All of us. I mean, I was in this course with one of the leading dental/medical instructors in the world on this subject, and he was just learning about the most recent research and studies. And
that's amazing.
Well, right. I mean, you think about
this guy's the most.
These are the leaders, but I mean, there's constantly studies that are being conducted. There are constantly new technologies.
Who's conducting the studies, Jeff?
Wow, I mean, big time. I mean, whether it be a Harvard, John Hopkins, these are big type outfits,
okay.
and here's the really amazing thing: this guy will not repeat. I mean, I repeat, refuses to not only embrace a new technology or a new technique until it's been proven, but he wants to see, like you said, who did it. If it was a true blind study,
right?
It's unbelievable.
What was their motive? What was their angle?
Exactly. If there was any politics involved, any of that stuff, which is it's very noble. And so, when I hear about a bite guard that another dentist makes, probably similar to the type of bite guard I make, it's not the fact they're making the bite guard wrong. It's the fact that they are seeing teeth and not thinking about the whole body. Okay?
Right.
And I'll tell you.
Not being holistic.
Correct.
Right? Looking at the whole body, the jaw, considering jaw, neck, position.
Yeah, I mean.
The whole of your trachea.
I want to tell our listeners how excited I was this weekend because in the middle of class, I actually texted Dr. Joe about a few things because this gentleman, this Dr. Olmos, Steve Olmos, he's world renowned, had so much emphasis on jaw position, which obviously it's very important in my line of work. In addition to the airway, which the jaw position affects the airway, and also the cervicals, which is what you deal with.
Sure.
And one of the best things that I've heard, and again, it was news to me, was on these forward head posture people who are fighting to breathe, C5, C6, and C7 are all subluxated, which I'm sure you know that.
Yes.
And I, of course, made sense to me.
That
and I'm a dentist.
Definitely contributes to the malposition of the jaw.
Exactly.
Right? The TMJ, which is shutting down the airway.
Bad neck position, bad posture, leading to bad jaw position, bad joints, or chicken or the egg. What caused one first?
What came?
And what's interesting.
So what you're telling me too is if the patient has chronic neck fixation, where the lower cervical C5, 6, 7 are locked up, it could be their TMJ causing my treatments not to last.
Not only that, I'll go one step further. Why are they in that position in the first place? I'm going to tell you, we're going to be changing some things in your office, and I haven't had the chance to. I'm dropping it on you live here. Are you ready?
Live, okay.
But I'm going to tell you, since I've been back, I have had 4 patients that I've known for the last decade. I know them very well. I know their mouths very well. And I looked at them with different eyes.
Joe, he knows their mouth inside and out.
Yes, I do.
Okay?
This is
Most
true.
dentists just know it inside. Jeff knows inside, outside, up, down,
this is
below,
true. Well,
above.
I don't like to just stop where others
everything.
stop. But I'll tell you, these are people that I know very well, and I know their history, and I know I looked at them with different eyes. Not only did I send every one of them home with my apnea, like the sleep monitor that we talked about, but I actually had one woman who I made a bite guard for, maybe in the last, say, 6 months. And she came in for an adjustment because a lot of times these need adjustments, and it's not because the patient can't wear them. It's because we need to make it comfortable for them to wear.
Make it more comfortable. Adjusting the mouth guard.
Exactly.
Right.
So
not a chiropractic adjustment.
That's correct.
Okay.
Just the plastic. And so what we did, I took a look at it. I said, well, this looks really good. I said, Gail, it's very important that you're wearing this, every night. She's like, well, I only wear it about 2 or 3 times a week. I said, really? Well, why is that? She said, well, it makes me snore. Well, how's that for a wake-up call?
Wow.
I said, well, wait a second. This has been going on for 6 months. And I said, well, I appreciate the honesty. She's like, yeah. She's like, my husband says every time I put it in, I snore. I said, well, Gail, let me tell you something right now. This is very timely, okay? I just got back from this extensive course, and we're going to do something for you. First of all, I made some adjustments to it that could very well have been causing some of the snoring. But I said, here's what we're going to do. I'm going to send you home with my monitor, and you're going to wear it one night without my appliance, and you're going to wear it one night with my appliance. And if your appliance is still making you snore, then I have a different type of appliance that we're going to make for you. And I said, my eyes are wide open. And you know what, Joe? I've been humbled, okay?
Well,
it's
God
something
bless
we
you for
think,
being humble.
Well, listen. I didn't know this prior to this class.
As much as you know more than any dentist I know, and then here you have a revelation.
It is. It's eye opening, and what it showed.
How timely that you just went to the seminar.
Right, and she, because if she would have told me that before, I said, wow. I never would have thought of that.
I think most dentists would think, oh, you have sinus problem, or take some sinus medication.
Absolutely.
Or something.
No question about it. And it was one of those things that was kind of an aha moment for me where, all right, this is real. I can't just, hey, if somebody's grinding their teeth, I want to protect their teeth, but I can't just assume that my appliance is going to fix that. Most grinders, we've talked about this in the past, clenching, has been shown as a defense mechanism to keep your airway open, okay? So if you're clenching, are you trying to keep your airway open? Maybe. If you are, my appliance isn't appropriate. We need to make you one of our sleep appliances that holds your airway open, and it's going to protect your teeth as well as keep your airway open so that you're not going to snore and you're not going to have those apneas. Now, there are other people who do clench and grind because of a central nervous thing and because of pain in the body. We're to use a word that was thrown around all weekend, which is dystrophy, okay? The body is in dystrophy. And this is, well, Joe, what is dystrophy?
Well, lack of, trophic pertains to the process of nutrition.
Right.
So lack of nutrition, your muscles waste away.
Right.
It's sort of like atrophy. A is total absence, and dis is lack of.
Body is not in equilibrium. Would you say that's a pretty good way of saying it?
Right.
And people who are not in equilibrium, they don't sleep well. I love when people talk about being, and they're like, well, when I sleep fine, but it's hard for me to get to sleep. Well, why is it hard for you to get to sleep? People who are in a dystrophic type situation where their body's not in equilibrium, they have some pains, and you deal with this every single day. You get a little lower back pain. How easy is that for a person to get comfortable and go to sleep?
Sure.
Right? And the majority of insomniacs report, when interviewed, that they do have some sort of pains in their body that's preventing them. They think it's
or even tension.
Tension,
right?
Of course.
I mean, you don't have a peaceful, easy muscle, as we talked about before, right?
You know what? I guess I threw the word pain around too much. You're right. Tension, discomfort. Let's use that word. Discomfort somewhere in the body is preventing you from A, getting to sleep, or B, staying asleep. You know, there's again, you're trying to get down to that good quality sleep so that you can refresh and rejuvenate. And if your body is in this dystrophy, we've got problems. And I'll tell you, watching, you know, this instructor and I've been, since I've been home, I'm telling you, I got problems here. I've been reading all my literature, really going back over this stuff, because it was so exciting for a person like myself whose big focuses in this practice are what? TMJ problems, sleep apnea problems. Obviously, we do a lot of cosmetic dentistry, which, of course, you love. But, you know,
let's not go there today, Jeff.
But, you know, the important things for me, you know, are those first two.
Right.
And for me to have sat there and had some of the voids filled in of where some of this overlaps it was such a great thing for me. I mean, myself, Rachel, my assistant, was with me. We were both just sitting there going, we finally get it. Writing down patients that we have had some trouble getting to that next level.
Isn't that great? You go to a seminar, you're thinking of patients, you can't wait to correct.
Right, and it was such a great thing for me, again, to put some of these things, you know, get your ducks in a row, and all of a sudden, I mean, right as we got back, implement some of this new knowledge. You know, so what I want to talk about today a little bit, before we forget, because I don't think we got to it last time, is people who do have these sleep problems, okay? I want to first encourage them. Anybody who has ever been told that they snore, or maybe they know that they snore, or maybe they've never been told they snore, but they wake up lethargic, never well rested. They're never, they're falling asleep, you know, on their way to work.
Dry mouth.
Absolutely. That's a great indication of just not good sleep, okay? I want everybody to do me a favor.
So
and
if you don't wake up refreshed, as we should wake up refreshed,
there's no
good,
reason,
energized, charged up, ready to go.
You got it.
Without coffee or caffeine. And
I'm so glad you brought that up. And I'm going to, let's remind me to get back to that, because I want people, first of all, to take the time, because I've taken the time, and this is to help you. Go to my website at rochesteradvanceddentistry.com. You go right to the Contact Us button, and right there we've got a bunch of patient forms. Okay, we have a patient form it's a sleep questionnaire. Not only does it go through what is, it's going to ask you a lot of questions that may pertain to your life. It's our sleep screening questionnaire, but there's actually some tests on here that will give us a rating and give you a rating on if you have a problem. One of the most important,
right on your website.
Right on our website.
Okay.
One of the most.
So can you repeat that? You go to your website.
Yep. Website rochesteradvanceddentistry.com.
Okay.
Go to the Contact Us button. It's right on the top heading.
Okay.
You're going to go right there. There's a little button that says Patient Forms. You can't miss it.
Patient
when you open
forms.
it up,
it'll
give a bunch of patient forms. The one you want to go to is the sleep screening questionnaire. And on there is what's called the Epworth Sleepiness Scale. It's the most well-respected and received little test out there to tell you if you may have a sleep breathing disorder or problem. And it's as simple as
they say
question.
Narcolepsy. I know so many patients or can't drive. They
Right.
fall asleep when they're driving.
Well, that's actually one of the questions here. What you're supposed to do is you rate yourself on 0 to 3. 0 being no chance of dozing off, 3 being a high chance of dozing off during a few of these things, and I'm going to read a few of them. Sitting and reading. Okay, I mean, if you're falling asleep while you're reading, falling asleep while you're sitting there, depending on what time of night, that's not a normal act. Watching TV, sitting inactive in a public place. Okay, this has happened to me on some of my nights where I just didn't get a good night's sleep, where I'm waiting in my doctor's office and they call me and I'm sitting there on my hand and I wake up,
Right.
and
Sure.
and again, if you're exhausted, that's going to happen.
Right.
But if that's an everyday occurrence, that's not normal, and I don't want people to think it's normal.
Right.
As a passenger in a car for an hour without a break, okay, actually, driving is, like you brought up, is a scary thing. People who are not well rested and fall asleep while they're driving. Do you have any idea how many accidents happen that way? In fact, the WebMD research article that I pulled for last week's kind of background to some of our stuff that we're talking about there's 7 things that they talk about, 7 health problems that they list with obstructive sleep apnea. Number 7 is car accidents. Okay?
Yeah.
It says daytime grogginess can put people with sleep apnea at increased risk of falling asleep behind the wheel. People with sleep apnea are up to 5 times more likely than normal sleepers to have traffic accidents. 5 times. That's significant.
That's significant. 5 times.
Absolutely.
Yeah.
So let me finish the Epworth scale real quick. Lying down to rest in the afternoon when circumstances permit. Okay? Is there a good chance of you dozing or not a good chance? Sitting and talking to someone. I mean, if somebody's dozing off in the middle of talking to somebody, we got big problems here. Sitting quietly after lunch without alcohol, okay? And I want to get to the stimulants and the sedatives since you brought up the caffeine after we finish this. And then finally, in a car while stopped for a few minutes in traffic. That's the Epworth Sleepiness Scale. Go through that and take that. If you score a 9 or above on that, you've got problems, okay? Or may have
Does
problems.
it say that on your website?
Yes, it does. And
9 or above.
9 or above. And so
Okay.
back to your caffeine, about the coffee. This is such a great comment that was in this class because a lot of people you ask, do you get good sleep? Yeah, I get great sleep. Really? Do you sleep all night? Oh, well, no, I wake up 5 or 6 times a night. Well, why are you doing that? Oh, I don't know. I had to go to the bathroom, this, that. People have excuses. Everybody has excuses. You should not be waking up 5 to 6 times a night. Do you agree?
I agree.
Okay. A lot of times it has to do with, again, discomfort in the body, pain in the body. Okay.
Sure.
A lot of times it has to do with clenching your teeth, and you sit there and you skate off one tooth. It's like
Right.
nails on a chalkboard. That's going to wake you up, right? But you shouldn't be waking up. More importantly, you should always feel well rested. And what happens is because
That's a biggie. You should feel well rested.
without what? Coffee, like you said.
Yes.
We actually had one of the staff members in this class as our patient, and we were asking these questions, and she said, "Well, no, I sleep awful." Really? Well, do you feel well rested during the day? Well, yeah, absolutely. Now you just said you slept awful, but how are you well rested? Oh, well, I just feel fine after about 4 cups of coffee.
That's right.
After
Wow.
3 times asking her, she finally mentions 4 cups of coffee. Now that becomes people's norm. I mean, anybody's going to feel good after 4 cups of coffee, right? But that is her life,
yeah.
And so a lot of this is taking the time with your patients, asking them questions, and then asking them the right questions. Because unfortunately, unconsciously, we will give people the right answers, okay? It's all everything. Life's a test.
Like you said, Jeff, asking the right questions.
Right. It's important, I mean, if I ask, you and I have talked about this, right? Hey, Joe, do you grind your teeth? Nope, Jeff, I do not grind my teeth. Well, I think we've proven to you after sitting there taking a look, there's no question that you grind your teeth, but you just didn't realize it.
Never realized.
Yeah.
I never wake up clenching my teeth.
Exactly.
And I sleep through the whole night. I don't wake up.
No.
I go to bed. I fall asleep right away. Don't wake up till morning. And I feel good. But I never wake up with my jaw in a...
Right.
But, I mean, that's why I thought I didn't. But
well, of course. And that's what everybody thinks.
But you can look at them and you can tell.
I mean, you can... Again, you look at them. I mean, and when I showed you with the mirror how your teeth just fit perfectly together, you got it. And most people out there, most people think it's like a character flaw if they grind their teeth. I want everybody listening to know that I grind my teeth more than the majority of people in the world. Okay, it's not well, maybe it's a character flaw. I don't know, but
you're still grinding them.
Yes, but they're protected.
But you're protected.
That's correct, and it's a very important thing because if you are grinding, is it again? Why are we doing it? Is it discomfort? Is it a sleep problem? Is it just the fact that your teeth are in a position that the muscles of your face don't want it to be? And that's the case
Sure.
in that's your
my
situation.
case.
Absolutely.
I could tell when you put me on the jaw tracker.
Yeah.
The K7. Did
Yeah.
I get it right this time?
Yes, you did.
I
yeah.
used to call it the K9.
Yeah. You know,
it's a K7 jaw tracker,
Right.
which I think everybody should have. But that proved to me, I knew intuitively my jaw was in the and the jaw tracker proved it.
that it was in a poor position
Yeah,
based on
that
your
was
muscles of your face.
Pretty cool.
You know, and
that's
so
where Joe, if you haven't heard, where you hook it up to electrodes.
Yep.
The muscles, right? And
we measure the muscles of the face.
The muscles.
And based on that most relaxed position,
isn't that great?
We're able to find out.
How many dentists do you know have that?
That's true.
Yeah.
That's true. That's very, very much on the leading edge.
Well,
yeah.
we like to be on the leading edge. And actually, I've got some new toys that are coming
good.
up.
I can't wait.
We're not going to unveil them today.
Use them on me first.
We actually may. You may like this one. I'm not going to give you any hints. But again,
Okay.
new technology, new techniques. But no. But really, what we want to make sure that people are identifying these problems. And if you're not going to let myself, another physician, another dentist do it, do a little self-diagnosis. Okay. Do a little research. Feel free to go to our website. Take some of these tests, because what I've learned, okay, and I've been doing this for a very long time.
You go to contact us on your web,
Yep.
and you click on patient
forms.
Yep,
and you just go right to the sleep screening questionnaire.
Sleep screening questionnaire.
Yep. And what that's
it's great
good
for kids, for the kids to take that, for the moms.
Absolutely.
And we were talking about it's back to school for ADD instead of putting your kids on drugs, because we said sleep apnea is not only high blood pressure, heart disease, diabetes, obesity, depression,
right.
Waking up feeling tired, but also ADD, ADHD.
You got it.
You're breathing. And you know what, Jeff? I never put 2 and 2 together till last show, last week. But it's great when you come up with a simple truth that it's like you have compunction. The light goes on in your head. Well, of course.
Yeah.
This could be a big contributing factor to the ADHD or ADD. I mean, diet as well, and life habits, and too much stimulus, electronics. But what about the airway?
Right. Well, it's interesting, and I'm glad you brought up diet, because I think that's actually what we should cover next week.
Next show?
I've got some great.
Can we call it
diet,
nutrition?
We can call it nutrition.
Okay.
Let's call it nutrition. Nutrition for a pain type person, a person who has, again, not the equilibrium they need, okay? I mean, this is jaw joint problems, TMJ problems, sleep problems. That all comes down to nutrition.
Okay.
And, you said it yourself, airway is important. I'm going to leave everybody with this, very simple thing. It's a rule of threes. Have you ever heard of it before?
No.
You can live without food for 3 weeks, okay? You can live without water for 3 days. You can live without oxygen for 3 minutes.
Wow.
Not much time there, okay? Oxygen is king, airway is king, and we need to make sure that if you have a sleep breathing disorder, you need to identify it and get treatment for it, because you're killing yourself slowly. And it's a scary thing. It's slowly and silently.
Hey, if any of you want to know that, you can listen to these shows, simpletruthsforhealthyliving.com, or call Dr. Jeff's office, 248-656-2020. He will be on next week. We're going to continue talking about the nutrition of snoring, sleep apnea.
Snoring, TMJ patients, all that. Some dietary recommendations.
Thanks, Jeff.
Thank
you.
That's
all for the show. Remember, in all that you do, eat or drink, do all things to the glory of God.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.